Children from poor families have near twice the risk of obesity compared to their affluent counterparts. Compared to the state, Hidalgo County has higher rates of people living in poverty, 17.5% versus 34% of the entire state, have an increased likelihood of developing diabetes, hypertension, and other chronic diseases as they become adults. We are breaking ground with novel research that will help others take notice of the importance of helping younger children lead healthier lifestyles.
Thank you all very much for including PSJA, Par San Juan Alamo Independent School District, and partnering with us. It is an honor and privilege to be able to align these efforts so that we can continue to improve our community. It is the vision of PSJA for all students to be prepared to compete and excel in a global society, to foster that multi-generational prosperity. There's a study by the 2015 National Youth Risk Behavior where they did a survey, and they showed that students were more likely to get A's and B's when they had breakfast in the morning, when they exercised, when they included vegetables. So that is why at PSJA and throughout the state and the nation, it's super important that we continue to allow and really encourage physical activity daily from our students from a very early age. PSJA, our Child Nutrition and Food Service, follows and goes beyond the USDA guidelines. It provides children with required servings of fruits, vegetables, and whole grains. I'm super proud of our nutritional department. They are always constantly thinking of better ways, not just to make sure that the meals are very nutritional. We have several dietitians, but we also meet the needs of different students to ensure that they're meeting their dietary needs, as well as culturally relevant and understanding the cultural background of our students, and be willing to try different foods. As we know, many students that come from low-income families sometimes do not have access to vegetables and fruits. And so we need to introduce them in a way to where they can enjoy them and be able to see the benefits of that. And so the Bienestar is a coordinated school health program that consists of bilingual curriculum. It includes the health, the PE, and the food services, and most importantly, the parents. And so this program is a program that is approved by TEA, and when we had the opportunity to participate at PSJA, it aligned very much with our vision, and we're really proud to be able to partner with Bienestar because of the efforts that it has shown in improving in many different areas. And parents want to be not just involved, but empowered with the right information. They want to understand that the district here at PSJA, we know it's not just about involving our parents, but how do we have that two-way communication? When we meet with them, either through Facebook or through a Zoom session, we're now able to get questions from them and identify their needs. One of the areas that has risen for our parents is being able to support them social and emotional. So we've hired social workers here at PSJA to make sure that we're meeting the needs of all our students. As you all know, when we have families that are from low income, they have many challenges, and we need to be able to meet their needs. And once we meet their needs, then we're able to then have that dialogue, that exchange, to ensure that we're also meeting their needs of their child.
Healthy life starts at home, and steps here to help.
Thank you.